Hey Kim,
And
thank you for having Rob and I out here to come and chat with you for a little bit.
thank you for coming out and doing this.
Of course, absolutely. We would just like to know first, how are you feeling today?
So. I woke up with a swollen stomach. I've been having a lot of GI issues. Been in bed most of the day and went into a somewhat mild flare from my lupus, which causes my whole body to hurt and shortness of breath and just a whole feeling of not well.
Well, thank you for getting up and doing this for us. I'm sure that's hard. For some of the people that may not know exactly your history over the past 5 years, can you tell us a little bit about your health, what you've gone through?
Sure. About 5 years ago, I had major surgery, and it was GI related. And right after my surgery, I started having all new GI issues. I was sent over to Cleveland Clinic in Weston for testing, and during that time, I started having numerous other symptoms. So I started seeing other specialists, and it got to be, I think, 7 or 8 specialists that I saw. Some of the symptoms seemed to relate that I was possibly they were checking for autoimmune diseases, but everything was negative.
Okay.
The following year, basically since they couldn't come up with anything and my doctors couldn't come up with anything, I was told my best bet was to go to Mayo in Minnesota.
Okay.
And the following year, my mom and I went up there. I was told I was going to be there for about a week. I was there for 3.5 weeks, saw 7, 8 specialists, and pretty much all my tests were negative again. And they said the same thing. They think I'm in the beginning stages of autoimmune diseases. At the end of 2013, one of my tests came back positive for lupus.
Now, what is lupus exactly?
Lupus is an autoimmune disease that basically your body attacks itself. It gets confused and it just, for whatever reason, it starts attacking itself and it attacks the tissue. It can attack all your organs. It can cause numerous symptoms, and there's no cure for it.
And how many doctors are you seeing right now?
I have 14 doctors.
14. What types of doctors exactly?
I have a rheumatologist, endocrinologist, immunologist, dermatologist, internist, a GI, pretty much everybody. Pretty much every pulmonary doctor, pretty much every part of your body that requires a specialist. I have. And I tend to go, a normal month is about a good 10 visits a month of doctor's appointments.
Wow, that's a lot.
Mm-hmm.
And when you see your doctors, when you have multiple symptoms from your illnesses, what do they generally say to you?
A lot of them call me their problem child. I think they get frustrated because they're treating according to symptoms and what I've been diagnosed with, but I still keep getting sick over and over and over. So
this is more treating the symptom than
the
cause. So can you tell us about Dr. Hughes?
Dr. Hughes, I actually started researching her last year, and she is a functional medicine doctor. Functional medicine, basically she's an MD that has integrated natural and holistic care. I would basically be seeing one person for my entire situation, and their goal is to get to the root cause and to treat more so with the diet, lifestyle change, supplements, and if need be, medication, but not as much medication as I'm currently taking.
Now, does insurance cover your visits and treatment by Dr. Hughes? No.
No, unfortunately, they're very expensive. They do take their time. I think the first visit is about 2 hours, and then I would follow up it depends on once I see her, but once a month. Instead of most doctors that take 15-20 minutes with you, they take half an hour.
Mm-hmm.
Like I said, the first visit's a couple hours.
Sure.
But no, it's not covered. None of it's covered.
Okay. Which is what we want to help with in this fundraiser,
right,
as much as everybody possibly can, is to help you get the treatment that you need.
Right.
are your hopes when seeing Dr. Hughes? Like, what do you?
Well, I have been just going in circles for the past 5 years. I have gotten more diagnoses. I started having chronic infections in 2014 for about 2 years. Every month I would get bronchitis or upper respiratory infection, something. And I finally found out a little over a year ago that I have primary immune deficiency in addition to the autoimmune diseases. So basically my body doesn't make enough immunoglobulins to fight off infections. So I have a similar case to the boy in the bubble, where whenever I go out, I'm exposed and I can get sick at the drop of a hat.
Yeah.
And I did start infusions. It's called IVIG infusions that were supposed to strengthen my immune system. However, I did it for a year and I did not get any better. And my doctor thinks that maybe I'm intolerant. So I'm hoping that with this new doctor, one person looking at the entire picture as opposed to running back and forth to 14 doctors, and trying to get to the root cause and treating more natural, I have a better chance at a better quality of life. I'm never going to be the person that I used to be. I have many things wrong with me, but if we can try to connect the dots and do it in more of a natural way, without as many medications, then I hope and pray for the best. There's no guarantee.
All we can do is be hopeful.
Yes.
And I know everybody wants that for you. So I know this is going to be a huge success, and we're all really excited to see what Dr. Hughes has in store for you. So thank you so much for having us.
Thank you.